Hello, my name is Andrea. I will be your trainer today for day 4 of our bootcamp series. Today, we are going to learn how to stay on top of the unstable bridge of preauthorization. We're going to be navigating the preauthorization and utilization review process. On day 3, we successfully built your upper body strength by grabbing on, holding on to those best practices to get reimbursed for our healthcare providers to get reimbursed. Today, we're going to be moving to the unstable bridge. We're going to be building your strength, gaining your balance, and I hope you're ready because today's workout, it's long, it's intense. So please do your best to keep your focus and your balance. So it's natural to feel like you might fall through when you're on the path to getting pre-authorization. But if you learn what the statutes and the rules say about medical necessity and Texas workers' compensation and what services require pre-authorization, you're likely to feel more confident. We also want you to know what the non-network treatment guidelines are and how they work in requiring pre-authorization. And we also want you to understand how to request pre-authorization and the process that you'll need uh, if you have to appeal a decision. So that way you're not going to fall through on the path to getting your patient the treatment that they need in their recovery. Of course, our main goal is to provide you with information. We want to educate you, make you stronger. This presentation is current. It's updated as of today, uh, June 18th, and it's for educational purposes only. So it's important to remember that the responsibility of knowing and following all of our rules and our statutes lie with you. So if there's ever a dispute, complaint, that needs to be resolved based on the rules and the statute, not necessarily what was said here today. So today we're going to be covering medical necessity and workers' compensation, medical services that require pre-authorization. We'll cover the pre-authorization and utilization review process, along with the independent review process, or you might hear that term IRO. And also, we're going to be pointing you to some resources that we have at the division that are going to help move you forward. So first, let's talk about Texas workers' compensation medical necessity. The overarching statute for all of our injured employees of Texas, for subscribers, employers, those are our employers who have workers' comp insurance, is 408.021. That's our entitlement to medical benefits. All of our injured employees are entitled to health care that is reasonably required, that cures or relieves the effects of their injury or illness that they sustained from their compensable injury. These services, they promote their recovery, helps them get back to work, or retain their employment as they are recovering. And first, we need to talk about what reasonably required means. Labor Code 401.011 says, one, it needs to be clinically appropriate for their illness or their injury that they sustained. So if the services have to be effective, you could demonstrate what you're providing is effective for the injury and that the services that you're providing are consistent with best practices and evidence-based medicine. Um, you need to show, are there scientific studies proving that the services that you want to provide help that condition, help them recover from that injury? And if evidence is not available, whatever you're providing must be consistent with established standards within the medical profession. So both the insurance code and the labor code, they talk about what's presumed to be reasonable and also evidence-based medicine. So medical services are presumed to be reasonable one of two ways. One, they're consistent with the medical treatment guidelines. And I'll be talking about that later on. So both sets of laws say that the services need to be consistent with evidence-based treatment guidelines or be approved through the carrier's utilization review process. The insurance code and the labor code talk about treatment guidelines. Treatment guidelines are just that. You can think about it like a guideline, a framework. Again, that evidence-based needs to be there. They need to be evidence-based. That means that scientific studies support the recommendations in the treatment guidelines. So we're not using unsound scientific studies or something that your friend that is a doctor said is, worked really good for their patients. We're using guidelines that are based on high quality studies. So you can see that in the official disability guidelines that we're going to be looking at here in a minute. In the ODG, these are outcome focused studies. So that means that they look at a lot of different outcomes for a lot of different patients and then determine what the evidence says. And they're designed to reduce excessive or inappropriate medical care, but they're still going to be safeguarding that the injured employees are getting appropriate medical care. So just because we have these guidelines doesn't mean that you can't go outside of that guideline or go beyond the recommendations. But again, keep these in mind and try to follow the evidence-based treatment guidelines. So the treatment guideline used for non-network injuries in Texas workers' compensation is the ODG, or the official disability guidelines. So this is an online subscription that is required by law, required by the rule. We recommend that you get it because if you're treating in workers' compensation, you'd basically be operating in the dark if you don't have the ODG. So keep in mind, though, if you are treating a network patient, our law allows them, the network, to choose their own treatment guidelines. So they could choose the ODG or they could maybe have a different one. So if you are in a network, look in your contract, check with the network that you're part of to see which treatment guidelines they use. Currently, about half of our injuries in Texas are non-network claims. The ODG is going to apply. So the guidelines have both treatment information and duration or return to work information. But for the ODG, keep in mind that we are only using the treatment section of the ODG. So we're going to take a look at that right now. All right. So this is what the ODG looks like whenever you log in. This is your dashboard. Okay. Up here you have your main search tool where you could look up anything, low back injury, any type of injury. Again, this is your dashboard. Here we can search for any condition or injury, and it'll show you duration, treatment, all of these things. So again, we're only going to be focusing on treatment. So I want to show you up here, you also have these tabs, right? You could go here, and then you will have these three options here. Something to keep in mind, this resource, it changes. So I don't know if you have maybe a doctor who has been in this system a long time and maybe they bought the book back in the day. They bought the ODG book, but it's not the same thing. Or maybe you had the subscription a couple of years ago and printed out, a common section like the low back treatment plans, but it's changing, right? So it is, again, it's a good idea to have this subscription. All right, so if you are a doctor and you're treating workers' compensation patients, you have your subscription, you've paid for it, this is where you would go to the treatment. And these are your filter options here. So everything recommended or not recommended. categories, you have all of your categories. So maybe you are an orthotics supplier and you just want to see what's recommended. You could go here. Imaging, you could do the same thing. Down here is where you could search by body systems. So if we take a look at the low back, it's going to pull up all of the treatment that is recommended, not recommended. Over here, we have all recommendations chosen. But if you go down to recommended, you will not only get what's straight up recommended, but also the conditional recommendations. Okay. So here's all the services that you might want to offer to that low back injury patient. So one of the things that I want you to keep in mind is that even if it's not recommended, you could still go in there and look for help documenting the exceptions. But one thing that I do want to show you while we're in here is if you go in and look for, let's say, um, let's see here. Where did I want to go? Bone growth stimulator, for instance. You could go in here and take a look at the risks and the benefits, but it's also going to give you this evidence summary with all of the studies and citations that your doctor could use to put into the recommendation or their pre-authorization request. Because again, that was conditional, right? So again, has all kinds of information that the doctor's going to need. All right. So again, you can search by keyword, diagnosis, types of treatment, recommended status, whether it's recommended or not, categories, body systems, and then those studies. Also, let me go back to that slide. If you are someone that prepares these requests for pre-authorization, it's really good for you to have this and to be able to go in there and look at that information so that way you can put it in your request. So make sure that the people in your office know how to do that. Also, there's a section in the ODG that used to be called Appendix D. And again, this is a guideline. So if your doctor's going outside of the treatment that the ODG recommends, Appendix D, it's going to give you guidance for those case-specific circumstances, be able to give more detailed documentation, because this is something to keep in mind through this whole presentation. You want to do your pre-authorization request right the first time, okay? So that's going to save you so much time and to get to where the Appendix D is, documenting exceptions, you could go up here to help and training. And then you could go to the resource library over here. And then from here, you could go down to documenting exceptions. It's found under the additional resources. So documenting exceptions to the guidelines. So that's how you find it on the ODG website. Again, just be sure that if you are someone who prepares pre-authorization requests, this is going to be an extremely valuable tool for you if you're having to go beyond what the ODG is recommending. So this is a picture of another way that you could get to it on that ODG website. So this is in your slides. Also, in the ODG, both for network and non-network claims or injuries, we have an Appendix A. So this is going to list all the drugs that require pre-authorization. We call these end status drugs. and these are the drugs that are not included in our formulary. And if you're prescribing a drug that has that N status on the list, think about it like this. You're going to need pre-authorization. So N, need pre-authorization. And prescribers, keep in mind, have your pharmacy in mind. They're not going to be in a great position to justify what you have ordered for this person. They're not going to have all the records. So it's going to be best, prescriber, if you write that justification for pre-authorization. If you've chosen this drug that has that N status, again, it doesn't mean that the patient can't have it, but it just means that you need to get pre-authorization for that drug. Something else to keep in mind, this list is not static. It changes. This is, again, from the ODG. This is Appendix A, and we've circled for you here where you can find Appendix A. This is a screenshot, again, from the ODG that you have to pay for to get this information, but we provide it for you free on the division's website. So if you go to your workers' compensation tab on the TDI website, go to the workers' compensation A through Z. You could go to P for pharmacy or N for N status drugs. So there's a tab for each month on the spreadsheet we have on our website. And as you'll see here, it's going to give you an N or a Y. So the Y status drugs do not need pre-authorization. N status drugs do. So again, if you're looking for that Appendix A, know your doctor. You need to determine whether it's an N status drug or not so that the doctor that's prescribing can prepare that request for pre-authorization if necessary. All right, so now let's take a look and decide what services need pre-authorization in the workers' comp system. So the rule for non-network pre-authorization, concurrent utilization review, and voluntary certification is Rule 134-600. And this has a list of non-emergency services that require pre-authorization under the section P. It's going to be P1 through 12. However, if your patient is experiencing an emergency, pre-authorization is waived. So they can get those emergency services, but the list of non-emergency services are going to be in 134-600, P1 through 12. If you're a hospital and that injured employee has come in through the emergency room, as soon as they get admitted, start trying to get pre-authorization. That's going to save you a big headache down the road. Also, in the list in section 134-600 under P, you're going to see anything that the ODG does not recommend, or maybe the ODG doesn't even address it yet. Those things are going to need pre-authorization. So drugs included in the pharmacy formulary are going to be on there as well. So office visits, something to keep in mind, office visits do not require pre-authorization. They can be looked at by the carrier for medical necessity, and that's going to be a retrospective review. That means you've seen that patient, you send in the bill, they can look at it retrospectively. But up front, office visits do not require pre-authorization, and we get calls all the time for people wanting to get a hold of their adjuster, the adjuster for the claim, so that way, they can see if they can have this office visit, but please do not waste your time doing that. So this here is a decision tree to get to your pre-authorization department. This graphic, it's to help your pre-authorization department determine what services require pre-authorization and which ones don't. So you have your steps here, and these are steps for a non-network claim, of course. These steps are going to probably do well with network claims as well. But the first question that you need to ask yourself for both is if the service that you're providing, um, is it on that list that requires pre-authorization or not? So if it is on the list in 134-600 P1 through 12, you need to request pre-authorization. If it's not on the list, go to the ODG, see if it's recommended, and then go from there. Oops. So remember, office visits do not require pre-authorization. Again, let me say that again. Um, and then if the ODG does not recommend it and you need to request pre-authorization, look at that Appendix D to help you justify that request for that service, and do it up front, right? Again, don't wait for a denial and then try to go back through the dispute process and try to justify it along the way. Do it right the first time. So check out that Appendix D and documenting exceptions. It's going to be really important that you do that. Um, if the ODG does recommend it, then you can provide it. But again, every service can be looked at retrospectively if you did not get pre-authorization up front. So um, on our website at the division, we have this page for healthcare providers. If you're at tdi.texas.gov, you go to workers' compensation. Healthcare providers have your very own page, and we have all of these topics down here for you. The one we're talking about today, of course, pre-authorization, treatment guidelines, can be found here. So we have it broken down by non-network and network pre-authorization. And also there's information down here about utilization review agents. So hopefully this can provide a good resource for you to refer back to if you need help along your pre-authorization quest. So what network services require pre-authorization? You're going to need to have to refer to the contract between you and the network. If you are treating an injured employee whose employer has uh, a policy that has a network, and this is by injury. So something to keep in mind: a lot of people have multiple jobs, and a person could have two injuries. One where they were working for an employer that had network coverage, and then maybe they left and they have another injury for an employer that did not have a network. So be very careful on your intake and registration so that you know, A, is this a network claim? And B, does your provider have a contract with that network? So get a copy of the network contract because that'll line out all of the steps that you need to take to get pre-authorization. And then also what needs pre-authorization. Also, drugs that are not included in the DWC formulary are going to need pre-authorization. So that, again, that goes for both the network and non-network claims. So check your contract for both medical services requiring pre-authorization as well as the process. So let's talk about pharmacy. Pharmacy is excluded from network contracts. Both non-network and network follow the same pre-authorization requirements for pharmaceuticals or medications. So if the drug is included in our formulary, it's going to be on the green side on the left on this slide. Our closed formulary includes all FDA-approved drugs, unless, and then we move to that red section on the right, the drug is in status. So I showed you how to get to that Appendix A, or again, it's on our website for free. And Appendix A can be downloaded, but just keep in mind each month has a tab, so you need to update it. And you could look at that to determine whether or not it has that in status. So if it does, it's going to need pre-authorization, or the pharmacy may not dispense it to the injured employee. So check his Appendix A, and Again, I highly recommend if you are the one getting pre-authorization because you're prescribing it, you're going to know the reasons why. Any investigational or experimental drugs are going to need pre-authorization. Any type of compounded medication, no matter what's in the compound. So even if that drug has all medications in it that are Y status, simply the fact that it's compounded, it's going to need pre-authorization. So that is our pharmacy for network and non-network requirements. All right. What is utilization review and what are the regulations? Um, we have a lot of people that call us and they want to know uh, what are the regulations, word for word, tell me what to do, or maybe they want to file a complaint. But these are the statute citations that you can use to research, to look up what you need. And it's also on the map that you received attached to the login instructions. So please refer to that. The insurance code for the network side, that's section 1305, is the Workers' Compensation Healthcare Networks chapter. And the Texas Department of Insurance uses the insurance code um, to certify utilization review agents, both on the commercial health side and on the workers' compensation side. And then 4201, that's going to apply to both commercial and workers' comp. Utilization review agents are also in our rules in the Texas Administrative Code, Part 1. And then Chapter 19, Subchapter, you'll need to apply to workers' compensation for utilization review. And then Chapter 10 also has utilization review, retrospective review for healthcare networks. And that is the network set of regulations for utilization review, pre-authorization in the statute. So remember, the insurance code also applies to workers' compensation on our side. So utilization review agents in that Chapter 19 of Part 1 of the Texas Administrative Code, Part 2, the rules that we've been talking about, that includes that 134-600 rule, the pre-auth rule. So if you have network and non-network regulation, they're going to harmonize, don't see a lot of conflict, and we will cover when there is a little bit of conflict, but that's going to be later on. Utilization review is a review of medical services for medical necessity and appropriateness, and it's done by the carrier. And the carrier's agent that does that is called the Certified Utilization Review Agent. Some carriers, they hire that out, they contract with the URA, or sometimes they'll have it in-house. Each of the utilization review agents have to be certified by the Texas Department of Insurance. So they're the ones that conduct the review. And something to keep in mind, if you're trying to send a pre-authorization request to the adjuster, you're going to slow down your process. We highly recommend that you send pre-authorization requests directly to the utilization review agent, because if you do that, they're on a time frame to respond to you, and all the laws and the rules are going to apply to them, and their clock is ticking. So if it's going through the adjuster and then to the URA, that's going to be some time that is going to potentially be wasted. So only the Texas Department of Insurance is going to certify utilization review agents. They are the only entities that can conduct utilization review. They're the only one that can say, yes, this service is medically necessary, or no, it's not. So if you're trying to work through the adjuster, just know that adjuster is not licensed to make utilization review decisions, and they could pass on information to the utilization review agent. But again, that's time spent sending it to somebody that isn't going to be able to make that decision. Adjusters are not medically trained. they're not certified. Most of the time, they're not licensed to make those medical necessity decisions. So if you see an adjuster trying to make those decisions, you could file a complaint with us. But please don't waste your time. Oh, I got to call the adjuster. I got to call the adjuster. No, please don't do that. It's only the URAs that are certified by TDI that can make those decisions. And that's in the Administrative Code, Section 28, Chapter 180.1. And then 180.1 says that a physician performing utilization review must hold appropriate credentials. So you might be wondering, who's actually looking at my pre-auth request, especially if they deny it. Just know that it needs to be a physician of the same or similar specialty as the physician who requested it, right? So they also need to have a Texas license. And if it's like a dentist or a chiropractor, it needs to be a dentist or a chiropractor reviewing it. And that's all in 180.1 definitions. So just as an example, you shouldn't have a chiropractor reviewing the request of an orthopedic surgeon. So also, in an adverse determination means that you do not get approval for what's asked for. That's going to be a denial. The utilization review decides that the medical services that they looked at or have already been provided, retrospective review, or a service that's proposed to be provided during a pre-auth request are not medically necessary or appropriate. So that's a denial. If you receive a denial, that is quote unquote an adverse determination, and it means the same thing. So they're saying that is not medically necessary. Keep in mind, receiving an adverse determination is not the same thing as saying that you should have gotten pre-authorization and you didn't. That would be an administrative denial. All right, so let's take a look at the non-network pre-authorization prospective utilization review and prospective pre, right? That means looking at services before they've been rendered. Again, we're going to refer to 134-600 for these, the first request. Again, that's the pre-authorization rule for non-network claims. So the injured employee or the representative, their doctor that's requesting the services, when making that request from the utilization review agent, we don't have a form that you need to fill out. So you're going to be using your own form or document. You're going to be providing general demographic information like the name of the injured employee, what the healthcare that you're requesting is. You don't necessarily need to put, specific CPT or HCPCS codes, but the specific explanation of the healthcare that you want to provide, number of treatments, specific time frame to complete them. And then this last bullet on this slide is really important. This is the information to substantiate, document medical necessity. And again, if you remember only one thing from this presentation, please do this right the first time. You don't want to have to spend time going through peer-to-peer discussion on an adverse determination and then having to turn around and go to an independent review organization for review. If you can substantiate that medical necessity, especially if it's beyond what the treatment guidelines are recommending, this is really going to save you some time to document those exceptions and substantiate that treatment. So that last note again, there's no pre-authorization form. Again, you'll be using your own. All right. Also include phone numbers, fax numbers, the name of the requester, the license number, and the NPI number of that healthcare provider. This is the healthcare provider who will render the service. If that's different, be sure to include their name and number. So if you're doing surgery at a facility, or if this is going to be done at a facility, name this facility, give that MPI number and the estimated date that you think the surgery will be done. Be sure and pay attention to the time frame that you've given, because you're kind of being held to that. If you say you're going to do it in the next 3 months and then you haven't done it, that pre-auth could expire. If you need more time to provide those services, extend the time frame with the utilization review agent if you can, because again, you need to hold to that estimated time frame. So let's go through the initial response from the utilization review agent. That means the first response. The utilization review agent should issue the requester, whoever requested it, a denial or an approval within 3 working days of receiving the request. If you submit the request on a Friday, the first working day is going to be Monday. The next working day will be day 1. Also, keep in mind, it's not 72 hours. It is 3 working days of when they receive that request. So again, thinking back, imagine sending the request to the adjuster, waiting a day or two until your 3 days haven't even started yet because it was not sent to the utilization review agent. So that URA needs to get the request. So instead of sending it to the adjuster, ask the adjuster for the URA contact information, or you could even find it online. Also, that URA must send written notification within 1 working day of the decision to both you, the requester, and the injured employee. Also, keep in mind when you're reviewing pre-authorization, the URA, they are not giving their opinion about extent of injury or any other issues on the claim. Like, they're just wanting to answer that one question, and that is whether or not they think it's medically necessary. So regardless of any unresolved issues about compensability, extent of injury, or relatedness, they're not thinking about that, only medical necessity. Even if there's an extent of injury dispute notice on file, that would be a DWC PLN 11 form. They only have to give their opinion about whether or not it's medically necessary. Another example would be if the injured employee, if they've reached maximum medical improvement, they can still receive medical services after. Again, as long as it's medically necessary. So utilization review is about medical necessity, period. Approval responses from the utilization review agent should include the specific healthcare that's requested, that they are approving, the number of healthcare treatments, specific timeframes. So if there happens to be any outstanding unresolved dispute on compensability, extent of injury, or relatedness, they need to let you know that on approval. And this is important, especially to those people in your office that are receiving the approvals for pre-authorization. Read them very carefully, because this might be the only opportunity that you get to find out ahead of time that there is an outstanding dispute on extent of injury or relatedness. So read it carefully. We're going to be covering compensability, extent of injury, relatedness, how to go through those disputes in future boot camps. So please attend those. Also, the URA is supposed to give you the pre-authorization approval number. So that way you can enter it whenever you submit your bill and avoid any conflict that way. Once the pre-authorization request is approved, the question is, can they withdraw it? Can they change their mind? Or maybe even send you some of the services they approved and some they didn't? They can't change any part of it without getting your approval in writing first. They can't withdraw it once they've said that it's medically necessary. And then they can't all of a sudden just say that it's not, and they can't partially approve, again, anything without your approval in writing. So it's either a yes or it's a no. It's medically necessary or it is not. Um, and we do see a lot of times people want to know if pre-authorization guarantees payment. It's kind of a yes and a no. The yes part is the insurance carrier may not deny a medical bill for a medical necessity if they've already said during pre-authorization that it is medically necessary. So in that case, they can't. It is a guarantee that they should not deny for medical necessity after they've already said it is. However, they could deny it for other issues. When you call us at Comp Connection and you say, I need help, I've been denied, we want you to read the explanation of benefits, the EOB, because they could be denying for compensability, extent, or relatedness. Also, keep in mind that what people are saying to you in a call doesn't hold weight of what is in writing. So the adjuster may have said, oh yeah, we're going to pay that. We're going to process it. What matters is what's in writing. So refer to that EOB. And remember, they should have notified you on the pre-authorization approval whether there's any outstanding issues on compensability, extent of injury, or relatedness beforehand. Of course, you might not get paid if you bill it wrong. So you got pre-authorization and then you bill it wrong, or you use the wrong HCPCS codes, or maybe your documentation doesn't support the level of the CPT codes that you built. If there are billing and coding issues, they're going to process the bill and look for any of those uh, during their processing. But generally, you're going to be protected from being denied for medical necessity if you've gone through the pre-authorization process and received approval. All right, for the utilization review agent responding not with an approval, but one of those adverse determinations or a denial. An adverse determination is going to be defined in Chapter 19, Rule 19.2003. And this means that the utilization review agent has determined that the medical services that you either provided or you're proposing to be provided on pre-authorization request are not medically necessary or appropriate. So again, this is not a denial saying, oh, you forgot to get pre-auth. That's on the administrative side. It's also not a determination whether your services are experimental or investigational. So if you are issued an adverse determination, which means denial, it must include certain pieces of information that are going to be helpful to you if you are going to pursue an appeal afterwards. And for the patient also, because they're going to need to know the reasons why the adverse determination was issued on that pre-authorization request. So first, the reasons for the adverse determination has to be based on uh, clinical evidence-based treatment guidelines and information. Also, it should include what to do if you file a complaint with the Texas Department of Insurance, the professional specialty and Texas license of that physician or doctor or other healthcare provider that made that adverse determination. So it needs to include all of these things. Also, the adverse determination must include the procedure for the utilization review agent's complaint or appeal system, and it needs to include the source that they used to make their clinical decisions. What was the screening criteria? What were the treatment guidelines? Also, uh, they need to provide a notice of the IRO, the independent review process, as well, and also the form to use if you want to appeal it, you want to take it up, you'll want to request review by the independent review organization, and that's going to be the LHL 009 form, and that LHL stands for Life Health Lines 009 form. And you'll find out more about are peer review requirements, reporting, sanctions, and Rule 180.28 of the administrative code. So if the utilization review agent, if they base their adverse determination on an existing peer review report, peer review reports are required to document certain things. So they need to have the objective medical findings, evidence-based medicine that supports their opinion. They also need to give the peer reviewer's name and their Texas license number, uh, the summary of their qualifications, as well as a list of all the medical records and documents that they reviewed. Sometimes callers call us on Comp Connection and they say the peer reviewer didn't look at this MRI or this imaging study. Again, they're supposed to look at everything. They're supposed to list everything that they looked at and give you that summary of clinical history as well as an explanation of their decision. So ask for that peer review report. You're entitled to it. So make sure that you have that um, if they denied you based on that. So that way you know what to address in the future. A little bit more information about peer review reports on a denial can be found in 133.308, medical dispute resolution of medical necessity disputes. If your pre-authorization request is denied using a peer review report and you pursue dispute resolution, go all the way to an independent review organization, and then that IRO overturns the denial based on the peer review report, that peer review report must not be used for subsequent medical necessity denials for that same medical service. That means that they can't use that peer review decision. Again, if the IRO is saying that the utilization review decision was wrong, we're overturning this. So that's something that you want to keep in mind about those peer review reports. Another question, another question that we get a lot at Comp Connection is, can an insurance carrier deny all future medical care? That language, that information is something that you might see coming from the carrier, and that's a violation. Like every single service that's requested needs to be looked at on its own merits. So even if a carrier says that this case is closed, um, they don't need any further treatment, that's a violation. And they can't deny all future medical care for a compensable injury. So if you do see that sort of thing happening, you can file a complaint and cite the Texas Labor Code section 415.002. And there are other violations by the insurance carrier that are listed in that statute. And it's always good if you're going to file a complaint to cite the statute or rule that you think that they're violating. So before a carrier issues the denial or the adverse determination, they must afford you a reasonable opportunity to discuss the treatment for the injured employee. So they must provide the utilization review agent phone number when they're calling you. They need to give you they need to document that good faith attempt that they made to contact you. And of course, we get calls about this that there wasn't a reasonable opportunity to talk to the peer review, or they called me at the last minute right before they made their decision. So if you do experience that, then definitely you can file a complaint and explain what happened. And the complaints, they're easy to file. It could be done as simply as writing us an email. Let's see. So when you do have that conversation, and they do make contact, and they're talking to you about your request, it needs to be a meaningful discussion. So they need to be discussing what services are under review, and it needs to be during normal business hours, and it needs to occur no less than 1 day before issuing that adverse determination. So that discussion, it needs to include a clinical basis for their denial that they're thinking of issuing, why they're going to deny, as well as the description of the evidence or the documentation that they're using, that they're basing their decision on, and also anything that's missing. So if they tell you that they're getting ready to deny this and you say, haven't you seen the MRI report? And they say, what MRI report? Um, they should tell you that they haven't seen it and you need to submit it. And then they give you the information during the peer-to-peer that might lead them to a different decision. They need to look at that uh, information. So again, meaningful discussions between the peer and the requester, the clinical reasons why they're proposing a denial. And then this is your time where you could bring something to their attention that they haven't seen and hopefully change their mind. So that discussion, again, should include the clinical basis for their pending denial, why they are going to deny, along with a description of the evidence and documentation, and then what's missing, what needs to be done. That way, you can, if you need to, request an appeal. So once you've received that adverse determination, if they still went through with that, you can appeal it. So this is a formal process where either the injured employee or the healthcare provider may request reconsideration of the adverse determination. So there's some healthcare providers at this point that just want to turn it over to the injured employee. And we don't suggest that because the injured employee is going to be looking to you for justification, or maybe if they have the Office of Injured Employee Counsel, that's a separate state agency that assists unrepresented injured employees. They're just going to, again, come right back to you asking for medical necessity information. But they can start the appeal process. The appeal can be submitted orally, can be in writing, must be made within 30 days of receipt of the decision. So pay attention to this, although there is a difference between network and non-network appeals. On the network side, you must request reconsideration within 30 days of receiving that adverse determination. On the network side, it's 30 days from the date on that adverse determination. So it's a little bit different, but just keep that 30 days in mind, knowing that these timeframes are very important because you don't want to have done all of this work up until now and then just miss a deadline. So next, you need to address the reasons for the denial in your request. Read that adverse determination, look at it carefully because you have to overcome the opinion. What they have in writing on their decision. Keep the definition of medical necessity. What the treatment guidelines say. Keep all of that in mind. So maybe you're tightening up your documentation based on what the ODG says about documenting exceptions. Again, you may be tired of me saying this, but it's going to benefit you and save you time and effort to do it right the first time. So put all of your efforts, especially if it's not recommended by the treatment guidelines, put all of your efforts in on the front end. Consider screening criteria that all needs to be listed in the adverse determination, any information, including anything that was missing from the original request. And again, make those deadlines 30 days to request reconsideration. On the utilization review agent side, once you've submitted your request for reconsideration, they have to respond as soon as it's practicable, but not later than the 30th day after receiving that appeal or request for reconsideration. So their response needs to be within 3 days of receipt for concurrent utilization review. If your patient's in the hospital, there are some exceptions, and 134-600 says that the response is due within 1 day in that situation. So again, no 134-600, pay attention to it. But generally speaking, they have 30 days to get back to you or as soon as it's practicable for them to respond. If the utilization review agent is another adverse determination, issues another adverse determination, that would be them saying the request is not medically necessary 2 times, then you can ask for an independent review organization. And IROs, they're going to be different from the URA. They don't work for the carrier like the utilization review agent does. And there's several independent review organizations that work in Texas workers' comp system. So be mindful of the time frame to ask for that IRO. Non-network side, not later than the 45th calendar day after you receive it. And on the network side, 45th day after the date on the denial. So can the requester start the pre-auth process over? If you happen to let a deadline lapse and you find yourself wanting to start the process over, uh, I missed my deadline. Can I resubmit the pre-auth request and start all over with step one? The chances of that happening are very slim to none. There has to be a substantial change in your patient's condition. For example, if you asked for injections and you never did them, or the injured worker was never available, or you missed a deadline 3 months later and you're like, well, they still need these injections. I'll just start the request over for the same thing. It's not going to happen because there needs to be a documented substantial change in condition for your patient wanting to restart the process. And the carrier is going to look at it and determine whether it was a substantial change or not. So also there's some services like spinal surgery. The ODG may say that they need a psychiatric review before the surgery. So look at the ODG and make sure that you've met any requirements before initiating that new request. Sometimes there's clinical prerequisites. Maybe they just want you, they want so many weeks of physical therapy before something more invasive happens. So just understand if you let the deadlines go, it's going to be very hard to start this process over. Here are two charts that we have for your reference. One is for non-network, and it shows you the basic 3 steps to the pre-auth request. Then you have your appeal process, and then the IRO request. And then this chart shows from the network side what happens. So they basically look the same, but there are some rule citations for you to look at and follow the steps to get to the IRO on the network side. So let's look at the form that you're going to use for your IRO request. After you request that first authorization, you got a denial. You asked for the second, you got a denial. You want to appeal the adverse determination. So now you're going to be filling out that LHL 009 form, and it's something that you may have seen on the private healthcare side because it's used for both workers' compensation and private healthcare. So the utilization review agent should have sent you this form to request a review by the IRO or the independent review organization. This form is called the LHL 009, request for review by an IRO. This form, it can also be found on our website. And then you're just going to complete this form within the deadline, submit it to the URA, not to TDI or DWC. If you have a question on how to complete the form, you could contact our TDI's MCQA, that's Managed Care Quality Assurance Office, and their contact information is here for you on this slide. And some tips for completing the form are in the denied services section. So use the information on the adverse determination. And again, it doesn't have to be necessarily including the actual billing codes. Also, when completing the injured employee information, if you do not have the DWC number, it's okay to leave that blank. But if you have it, please include it. It's going to help. Hopefully, the adverse determination is going to have that DWC number on it. And there's sometimes questions on the federal tax ID number. If you don't know the federal tax ID number for the provider, you can place NA, like you don't know. Section B that talks about the provider acting on the injured employee's behalf. That should only be completed if it's different from who is in Section A. the healthcare provider filling out the form, if it's different from the person receiving the second denial, then you need to fill out section B. And again, call MCQA if you have questions. And then disregard the release section. This is not for workers' compensation patients. Utilization review is going to complete the bottom portion. So remember your deadlines. And if you're sending this back to the URA, or when you send this back to the URA, um, remember those deadlines. And again, do not send it to the division, the DWC, the Texas Department of Insurance. Do not send it to us. The utilization review agent, they are going to submit the request for the IRO to MCQA TDI, at TDI. So our medical quality section, they are going to turn around and assign the independent review organization. So the company that denied the services is for the utilization review agents to fill out that section down here. So here's an infographic on what the process looks like for the independent review of the denial that you're disputing. And a lot of healthcare providers on that first denial, they're like, I don't want to do it anymore because they're going to charge me. But this chart hopefully is going to show you that most of the time it's going to be the carrier who's going to pay for the independent review organization fees, not you. So on the left-hand side in the yellow, these are all the situations where the carrier is going to pay for that IRO fee. And it's either going to be $650 or $450, depending on the type of review that's being done. So the carrier will pay the fee associated with all pre-authorization. If it's a pre-authorization review, you are not going to pay the IRO. You're just going to have to invest all of that time filling out the form and asking for the IRO. That's it. Also, the carrier will pay on the network side for retrospective reviews. So let's say it's an independent review organization request for an office visit. If the provider is in network and they get denied retrospectively, then the insurance carrier, they're going to pay that IRO fee for the review. So the only time that the requester or the physician is going to pay the IRO fee is on the non-network side. Let's say it's for an office visit, but the carrier says it is not medically necessary. In that case, the requester would pay that IRO fee, which is going to be the provider. So keep in mind, if you win after you've appealed this and gone through the IRO process and their decision is overturned, the carrier has to pay you back for that IRO fee. So again, most of the time, IRO fees are going to be paid by the carrier. So what happens if the IRO issues a decision, an adverse determination, and you want to appeal? This is covered in Rule 133.308, Medical Necessity Dispute Rule. You can appeal the IRO decision through a contested case hearing at the Division of Workers' Compensation. So you don't need to get or go through a benefit review conference first. You go straight to contested case hearing with our hearings department. That IRO decision, it's not an agency decision, so they're a completely separate entity. So DWC, we are not considered a party to this appeal, and it's going to be handled through our agency's hearing process. And those hearings, they can be expedited for certain types of injured employees, like first responders. The IRO, they're not required to participate in the CCH. So always when you're going into dispute resolution, you made the request. So remember, you have the burden of proof to overcome the decision that was made. Do it right the first time. You're going to be going up against 2 adverse determinations by the carrier, as well as an adverse determination of the IRO. So you need to overcome it with a greater weight of evidence that's based on medical information. So again, this is another chance to prove your case, but you see how it's becoming more and more difficult with each step. So doing it right that first time, is going to be the best thing you can do for yourself and the injured employee. So before the contested case hearing, a party may send a letter of clarification. That would go to the division. We have a staff member called a chief clerk. So that could be asking for the independent review organization to clarify the existing decision. So we're not asking the IRO to reconsider the decision. We just want clarification. So the administrative law judge, who's a division employee, will consider the applicable treatment guidelines during the contested case hearing if it moves forward. So what happens if you do not win at that contested case hearing? Well, there's one more step to appeal. The party may appeal after all of these administrative remedies have been exhausted, and then that would go to the courts outside of the division. So this would go to judicial review, and we are not party to that. So you be on your own. If you do pursue it to a court outside of the division, we may charge you for the expenses to copy all of the documents that were used for the contested case hearing. But again, you can go beyond the contested case hearing to the court of general jurisdiction. So we want you to understand why it is so important for you to support your pre-authorization requests the first time. Don't miss any deadlines. This is a rule that safeguards the injured employee, and it's really important that you understand Labor Code 413.042. This is called private claims administrative violation. And what it says is that you, the healthcare provider, get an adverse determination. You just decide to bill the patient for that procedure. That's called pursuing a private claim, and it's a violation on your part. So if you've gone through all of those steps and it's no longer appealable, the adverse determination becomes final. You can't turn around and bill that patient and give them that service. So you can't pursue that private claim. It's different if you've been denied for extent of injury and you go through and get final adjudication. Our administrative remedies say that, this low back pain is not work related, or this injury is not work related, then you can pursue a private claim. But for medical necessity decisions that are finally decided that they are not medically necessary, you can't bill a patient. So don't try to pursue that private claim. And just know that 413.042 is out there. It's overarching everything. Do your pre-authorization requests right the first time so you don't have to encounter that. Takeaway number one, know your definitions of medical necessity. Make sure that your doctors know the language, print those out, know what they mean. Know the treatment guidelines that apply for your patient or the screening criteria. Know how to document exceptions if that's applicable. If it's not recommended by the treatment guidelines, but you think it is necessary, document those exceptions up front. Any information that might be missing, get those together so that you can do that request right the first time or during the request for reconsideration, just as soon as possible. Any information that might be missing, get that together, and also know your deadlines and keep those in mind. Those are really important things for you to understand about this process. And we want our injured employees to get the right care at the right time. We want you to get paid. We want you to know this process so that it can help you and the injured employee. All right. So we covered medical necessity and workers' compensation, medical services that require pre-auth requests and utilization review processes, independent review processes, as well as DWC resources. So it is time to wrap up our discussion and train your brain. So we put together 5 questions based on today's webinar. Question 1, which of the following is not true about the Texas Labor Code's definition of healthcare reasonably required? And If evidence is not available, you cannot provide treatment to that injured employee is what most people chose. Um, Very good. Let's see. Clinically appropriate, effective for the injury, provided with best practices consistent with evidence-based medicine. All of those are true. So if evidence is not available, you cannot provide it. Um, but, you know, you can try to justify it. Very good. The name of the non-network treatment guideline is the official disability guidelines. Very good. 86% of you got that right. Next, the utilization review agent must approve or deny each pre-authorization request, regardless of unresolved issues of compensability, extent of injury, or relatedness. Absolutely 100% true. Most of you got that. Um, if your pre-authorization request is denied, you can just bill the injured employee. I am so proud right now. I'm going to cry. Thank you for knowing that, taking that away from this. Absolutely. 100% of you said it's false, and that is right. Next question. After completing the LHL 009 form, request for a review by an independent review organization, the healthcare provider should send it to the Texas Department of Insurance. And most of y'all said this is true. It's not. This is false. Send it back to the um, to the URA that issued the decision that you want to appeal. They are responsible, not you. They're responsible for moving it forward. So send that form back to uh, the URA that denied your pre-authorization request. Okay, so thank you for participating in that. You can X out of that to get it to disappear from your screen. All right. So next time, we are going to the unstable bridge of, I'm sorry, we're going to, we're going to be reviewing the denials based on compensability, extent of injury, and relatedness or liability. So our learning objectives for that is going to be to learn when an insurance carrier is liable to pay for medical services, right? So understand what it means when an insurance carrier denies a bill for medical, I'm sorry, for denies a medical bill for compensability, or we call it SURL, right? Compensability, extent, uh, relatedness, or liability. So also know what forum to use to pursue dispute resolution. And as always, please contact us at Comp Connection if you have general workers' compensation questions, medical providers, any questions about what was covered today or in any of our other boot camp sessions. We're available to help you. And we thank you so much for spending your time with us today.